I'm going to introduce our latest research on an ultrasound-based nomogram for identifying abnormal bladder shapes during filling in women with overactive bladder. I have nothing to disclose. This study was funded by the NIH grant and the VCU School of Medicine Summer Research Fellowship Program. The prevalence of overactive bladder in the US approaches around 20%, and invasive urodynamic studies are needed for some refractory cases, which are uncomfortable and stressful. One previous study used 2D abdominal ultrasound to quantify bladder shape and found the changes in bladder sphericity have linked to non-voiding contractions. Our group also found abnormal height-to-waist ratios have association with overactive bladder. The aim of this study is to develop a bladder-shaped nomogram using 3D abdominal ultrasound images from female participants without OAB and to validate the developed nomogram using the same data to quantify the criteria of irregular bladder shape. Then to test the nomogram using the images from female participants with OAB. Participants with and without OAB are based on the SIQ OAB survey question 5A result. We employed 27 non-OAB women participants with 533 ultrasound images to generate and validate the nomogram. To test the nomogram, we employed 24 OAB women participants with 264 ultrasound images in the volume range of 100 ml to 500 ml. A trained technician manually traced the parameter of all bladder images in 6 cross-sectional planes. And 4 different functions were tested for the nomogram generating to approximate the best fitting. We developed 3 nomograms, which are transverse, sagittal, and coronal, with 95% of confidence intervals. We tested power, polynomial, exponential, and linear functions, and the power functions was employed to generate the nomogram bound, as it has the highest R-square value. We tested the criteria of at least 2 or 3 measurements out of bound to define the criteria, and finally select the 3 or more measurements laying out of bound at the threshold value. For the nomogram testing, the transverse and coronal nomogram detected 2 OAB participants, in which one is detected as having larger transverse and coronal parameter, and another is detected as having smaller transverse and coronal parameter. The sagittal nomogram detected 5 out of 24 OAB participants. For the results, the sagittal parameter volume nomogram successfully identified 5 out of 24 OAB with a p-value of 0.018. If we combine 3 parameter nomogram to identify the irregular bladder shape, we can find a smaller sagittal parameter that is wider in the transverse plane, and also a larger sagittal parameter that is taller in the coronal plane. We believe this is a non-invasive method to quantify irregular bladder shape using ultrasound images, and it has the potential to subgroup a portion of OAB patients. Also, if we combine 3 parameter volume nomogram, we can identify an accurate irregular bladder shape.